Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over how to stop or relieve mid-back pain. But before I do that, we'll go over the symptoms, the causes, the risk factors, the normal healing cycle, and then we'll go over the steps that you can take at home to relieve or stop your mid-back pain. So what are the symptoms of your mid-back pain? You might feel stiffness, tightness in your mid-back, and if you have issue like degenerative disc disease or herniated disc that compressing on the nerve, you might feel numbness or tingling in the nerve area of the distribution of the thoracic nerve, and that's usually around this area in here and wrapping around to your chest area, which is really very rare cases, but most likely stiffness, and that's usually happen if you have really bad posture or you have kyphosis or other risk factor. So what are the risk factors for mid-back pain? One of the main risk factor is poor posture, poor body mechanic. If you slouch in the front of the computer for a very long time, or the TV, or in the front of your phone, that could cause mid-back pain. That's a high risk factor, and it would cause kyphosis, or if you've been diagnosed with kyphosis, which is excessive curvature to the mid-back, and that is commonly in the mid-back, sometimes in the lower back, that you have more curvature here that will cause mid-back pain. The other risk factors, if you are experiencing osteoporosis or have rheumatoid arthritis in the mid-back, that could cause pain, degenerative disc disease, herniated disc disease, facet joint syndrome, and I have videos on all these risk factors in my YouTube channel. Feel free to check it out. So you can see here in this image, your disc should be look like nice and normal like this and smooth, and then you have the spine here, the spinal cord, and then you have the spinal nerve. And when you have herniated disc, it usually happen that the disc is pushing on the nerve, which is not very common with the mid-back. It usually occur more in the lower back and the neck area. And you can see from the side view here the herniated disc, and I will show it to you in the lumbar because I don't have it in the mid-back here. So normally your disc should look like nice and smooth like this, and then when you have herniated disc, you see that red part that's sticking out. It's sticking out and compressing on the nerve that's going down, and typically if that's happening, it usually happen here, but that's not a very common area for herniated disc. Most likely you might have facet joint syndrome, a lot of stiffness, tightness, muscle spasm in this area that cause the mid-back pain. One of the common risk factors and causes for mid-back pain is poor posture. So you can look in this image, like when your neck in neutral position, 0 degree, your head weigh 10 to 12 pounds. But when you start to slouch forward all the way like this in the front of your phone, your head weigh 60 pounds. Your neck muscles are not built to carry 60 pounds 5 to 8 hours a day. So if you maintaining that poor posture for a very long time, I'm already start to feel tightness, stiffness in this area from that posture of slouching forward and looking down. So that's one of the common risk factors. And when you have that for a very long time, you're going to start to have micro tear in your muscle and building the scar tissue and fascial restriction, and that will lead to mid-back pain. So how to treat the mid-back pain? Before I go over the treatment, we need to understand normal healing cycle, because it will make sense how to get to the root cause of the problem, and it is instead of using modality that does not work. So I want you to visualize a normal healing cycle with the external paper cut, like here. When you have paper cut, you will start to have inflammation, swelling, redness, the blood start to rush to that area, experiencing pain, decreased range of motion. The second stage of healing is called a proliferation stage. That's when your body starts to build a scar tissue. During that stage in the second image here, your body starts to build a scar tissue, fascial restriction, muscle spasm, trigger point. perfect scenario, actually during the maturation stage, your body should get rid of the scar tissue, fascia restrictions, muscle spasm, and clear up everything. That could take days, weeks, months, or years. As we get older, the speed of the healing process decreases significantly. I want you to visualize the same process happen internally. You have a poor posture, poor body mechanic, you cause a micro tear in that area, so your body builds inflammation. That tear is inflammation, and when you look here in the muscles, this is normal look for the muscles, nice and smooth here. When you have a micro tear, you have tear in the muscle randomly, and then your body has to build the scar tissue to glue things together, and usually that happens randomly. The problem is if your body does not get rid of that excessive scar tissue, and that's in the way of everything. So because our muscle should act like a rubber band, should stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band, and when your muscle try to stretch, it will not stretch much, and that could compress on nerve and artery and cause symptoms. So let's relate it to the low back pain. So if you have herniated disc or you have any other issue, that will cause compression on the nerve and muscle spasm, because the scar tissue and the inflammation that will cause the pain. Remember, all of these just labels to tell us the location of the problem and also the symptoms, but does not tell us how to treat it. So we have to step back and look to the body through the healing cycle to get to the root cause of the problem. If you have a chronic mid-back pain for a very long time and has not been healed, there's very high chance your body going back and forth between inflammation and proliferation stage. That means it did not heal, because if you are in maturation stage, that means your mid-back pain has been healed. So what treatment can be used to treat mid-back pain? I'm gonna go over some of not effective treatments so you don't have to waste your time. Those treatments are not effective based on the studies, and also when we relate that to the normal healing cycle, it will make sense why this treatment does not work. One of the common things that been used by a lot of healthcare providers, stem, heat, ice, and based on the studies, it provides either temporary pain relief, but there is no long-term pain reduction. And when we look at that normal healing cycle, you will notice it's not going to do much to the inflammation, and it's not going to do much to the proliferation stage. So it's basically masking the symptoms. The other thing that's commonly used is massage and foam roller. And think about it this way: if you have inflamed area and open wound, do you want to rub it to inflame it more? That will make it worse. And based on the studies, massage and foam roller either provide short-term pain reduction or no pain reduction. And when I go over the fascia system, it will make a lot of sense why foam roller and massage do not work, because it's not gonna go deep enough to release the deep adhesion of the proliferation stage. So the other thing that's commonly used is stretching, and I personally do not recommend the stretching to my patient, because based on the studies, it's provide either temporary pain relief or no pain relief. But the problem is, if you have micro tear in the muscles or inflamed area, do you want to stretch it to inflame it more, to actually tear it more? No. So based on the studies, stretching does actually cause more inflammation. And when you cause more inflammation, your body has to build the scar tissue to heal that area. So it's actually could make it worse. There are alternative options to stretching that safer, and you don't have to really make things worse with the stretching. So the other thing that's commonly used by healthcare providers like chiropractor, physical therapist, occupational therapist, joint mobilization, or they call it manipulation or adjustment. But think about it this way: you're just moving the joint. Is that going to do anything to the inflammation? No. Is that going to break the scar tissue, release the fascial restriction? No. But if you have internal inflammation in the joint and you keep moving it, that could cause more inflammation. And based on the studies, joint mobilization either provide short-term pain reduction or no pain reduction. So the other thing that commonly used, strengthening exercises. And the problem with that is if you do it during the inflammation stage, it's going to inflame it more. So there is much more effective way to actually strengthen your muscles. So it's called function training, core stabilization. Instead of doing ankle pumps or like bicep curl, which is not very effective to transition to function improvement, doing function training is much more effective approach for mid back pain. But before I do the exercises and the function training, I have to release the tightness, decrease the inflammation, and then patient can be able to maintain proper posture when we do the posture training or the function training. So how to treat the root cause of the mid back pain? We have to break that vicious cycle from both ends, the inflammation stage and the proliferation stage. For inflammation stage, if you have a minor mid back pain, just take it easy, avoid lifting. 5 to 7 days should be good enough to get you back to normal. But if you have chronic condition that you have a lot of inflammation and proliferation, 5 to 7 days, that will not do much work. So we have to be aggressive on decreasing the inflammation. So what I personally use and the MagnaHeal 2 to decrease inflammation. So the range of the magnetic field from the MagnaHeal 2 is about 3 inches. So it can penetrate the back 3 inches if you have any internal inflammation to decrease inflammation. For mild, moderate inflammation, it works very well, few sessions to get the inflammation under control. The other thing I like to do is put all of my patients on anti-inflammatory diet, because we know there's certain food cause internal inflammation in the body, and when that happens, it will slow the normal healing cycle process. And so I like to put all of my patients on anti-inflammatory diet so their body will heal faster. If you have chronic condition and other health issue like rheumatoid arthritis, diabetic, high cholesterol, there's very high chance you have vitamins and mineral deficiency, and that in general will cause slowing your healing process. So one of the way you can actually address that, take advantage of Ask ASTR. It's askastr.com. It's a free online medical evaluation. This questionnaire usually take about 5 minutes to answer, and the software will guide you through the understanding what possible vitamin mineral deficiency that might affecting your body to slow healing. At the same time, while we decrease in the inflammation, we have to decrease the proliferation stage. So what I personally do, I use the A3 to break the superficial scar tissue, and I use the A5 to release the deep adhesion, deep scar tissue, deep fascia restriction, and trigger point. That's why I said the massage and foam roller are not effective, because it's impossible for the foam roller and massage or knuckle to go deep enough to do deep adhesion release. Think about this way: if you have a motor that you want to unscrew a screw inside that motor, and the screwdriver you have is short, it's impossible to really unscrew that screw. That the same thing happen internally in the body when you have a scar tissue, fascial restrictions. If you cannot apply mechanical force on the adhesion area, it's impossible to release it. So with the knuckle, you cannot really go deep enough in the body, but with the A5, I can go 2.5 inches to 3 inches deep in the body. The other thing that overlooked by a lot of healthcare providers is the fascia system. Briefly, I'm gonna explain the fascia system because it has significant effect on the mid-back pain. So when you look at the fascia system, you will see here the white tissue here, that's actually the fascia system. And at the superficial layer, it's wrapping the entire body. It's like a Spider-Man suit wrapping the entire body. Next time when you go get meat, look for that white filament in the meat, and that's actually the fascia system. So the system is very complex, but don't worry, the treatment is very simple. So we have two main categories: superficial fascia layer and the deep fascia layers. And the deep fascia layer is actually divided to 4 subcategories: the epimysin, the apoptotic fascia, epimysin, premiysin, and endomysin. The apoptotic fascia wrapping a group of muscles, and then the epimysin wrapping each individual muscle, and the premiysin, you can see here the epimysin wrapping each individual muscle, then premiysin wrapping a group of bundle of muscles fiber, and then each individual muscle fiber is actually wrapped with endomycin. To make things worse, each of these layers has 2 to 3 sub-layers on the top of each other. That's why I said massage or foam roller impossible to release deep adhesion, because when you have deep adhesion in the fascia layer, deep scar tissue, deep trigger point, your knuckle, your hand, your foam roller is not gonna go deep enough to release it. You have to have a mechanical force on the deep layers, and you cannot pick and choose. I will work on releasing the superficial layers and expect the deep layer will release by itself or solving the problem, because it's very common to have adhesion in all these layers that keep it stuck together. So what I personally use, I use the A1 to release superficial fascia layer and apparatic fascia layer, and then I use the A5 to release the epimycin, premiycin, and endomycin. So to sum it up, how to get to the root cause of mid-back pain, we have to look at the healing cycle. If you have inflammation, we have to decrease the inflammation, simultaneously release all the adhesion that's causing that tightness, causing the bad posture, or causing the pain. While we're doing that, after the release, it's going to be very easy to correct the posture, doing posture training, core stabilization, function training to correct your posture, because a high chance with majority of mid-back pain it occur from poor posture. So if you have any question or comment, leave it in the comment section below and I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.